So in this particular lab, there'll be several short videos that walk through the locations of different skeletal muscles in our body. And in the first one, we're going to look at the muscles of the head and neck. So before we dive into the muscles of the head and neck, I do want to review a little bit from last week and maybe talk about it in a little bit different way. So remember that muscles are only able to contract, so they can only pull. They cannot push. And we defined the origin and insertion of a muscle last week. So the origin is the part that bone that it's attached to is not moving, right? Where the insertion is, that's the bone that is going to be moved by the muscle. Now in your textbook, it refers to this sometimes besides origin and insertion. It may refer to it as a superior and inferior attachment. Or on a limb, it may talk about it in terms of a proximal and distal attachment. So remember, the origin part, that bone is not moving, and where the muscle is attached, the insertion is that's the bone that's being moved when the muscle is contracted. So there are three types of movement, or muscles that do movement. So we have an agonist, which is also called the prime mover. So that's going to be the muscle that's primarily responsible for a particular movement. Then we have an antagonist. So that is essentially the muscle that's going to do the opposite movement. So if one muscle is providing the flexion movement, then there'll be a different muscle that's the antagonist to that does the extension. Now, a synergist, this is a muscle that may not be the prime mover, but it may assist the prime mover in a particular motion. Now, when we go through and we talk about muscles, right, you're going to be learning the location of these muscles. The other important thing is to understand the type of movement that when these muscles contract, the type of movement that they cause. Now, that's not something that you necessarily want to have to memorize. This muscle does this movement, this muscle does that movement. Instead, you want to learn based on the location of the muscle, the attachment sites. When that muscle shortens, right, what would happen when that muscle contracts? So let's look at the biceps and triceps brachii and just think about that. So the biceps muscle, and we'll also, as we go through, especially when we're talking about the upper and lower limbs, we'll talk about the compartments. So the upper part here, right, where the humerus is, that's the arm, okay? And then below the elbow, that would be called the forearm. So it's important for us to make sure we remember that terminology. So the biceps brachii is in the anterior compartment of the arm, and the triceps brachii is in the posterior compartment of the arm. The biceps is not the only muscle that's involved in flexion of the forearm. It's not the only muscle in the anterior compartment of the arm, but we're going to focus on it for just a minute. Now, you cannot see exactly in this image the exact spots that the origin and insertions are occurring, but for the biceps, okay, the origin is actually the scapula. So the biceps have two heads, so that has two origin attachments. The supraglenoid tubercle, which if we think about the name of that, supra would be above, right? We know that this right here is the glenoid cavity, okay? So supraglenoid means it's attaching to the scapula above the glenoid cavity. And it also attaches to the coracoid process, which is part of the scapula. Again, that's superior to the glenoid cavity. The insertion or the distal attachment is going to be on the radius, okay, on this part called the radial tuberosity. So we have an attachment here, right? Let me just change colors for a second. So let's show that our origin is up here, right, as part of the scapula. And let's change colors. Let's show the insertion down here on the radius. Now, with the muscle being attached at those two places, if it shortens, right, only one thing can happen. That means that when it shortens, it's going to have to bring the forearm, right, up towards the body, right? It's going to shorten the angle So this angle right here between these two bones, right, it's going to shorten that angle. And so that's what we would call flexion, right? Flexion means the angle between two bones gets smaller, and that's exactly what's happening. So if we know that that muscle is located in the anterior compartment of the arm, right, or the front, then we know as that muscle shortens, it's going to have to bring the forearm up. So we don't have to memorize that it's involved in flexion. Now let's look at the triceps. So the triceps, so the origin of the triceps is also part of, so the triceps has two attachment points, but part of that, I'm going to just change it to green, is also going to attach, okay, to the scapula. This attaches to the infraglenoid tubercle. So right up here, okay, on the scapula. Let me change colors. And then the insertion point is actually the olecranon of the ulna. Remember, the ulna has this big process, right? So when you think about it, okay, if it's attached to the ulna and it's attached up here at the scapula, when that shortens, right, it's going to extend the forearm. So if it were, if the forearm was here, right, if it was this direction, it's going to bring it to straighter or, extension. Now, my reason for talking about this is it's really important to think about the location of the muscle. So the triceps is in the posterior compartment, which means those muscles then, right, are in the arm, are going to extend. So we want to think about where the muscle is located and help us remember and predict what the contraction of the muscle will do rather than memorizing every single action of every single muscle. All right, moving forward. Now let's talk about the muscles of the head and neck. Now, obviously, these are just a selection of a few muscles in the head and neck. There are many more, but these are the ones that I want you to be familiar with, and I want you to be able to locate on some models that I'm going to show you in a minute. Now, in your lab activity for the week, there's a Word document, and you'll see that there are links for many of these muscles. If the anatomy and physiology reveals has a movement of the muscle, I have that linked for you because I just want you to be able to have a chance to see what that looks like. But just like we looked on the last slide, we're going to look at where the muscle is located, what the shape of the muscle is, so we can predict what kind of action that muscle is going to cause. Okay? So remember when we talked about naming our muscles, they're named for different things. So let's look at the names of some things before we go to the model and see if we can kind of tell something about where this muscle is located. So the frontalis muscle, that one is easy. We know there's a frontal bone, right, of the head. So that's going to be the muscle that's over that frontal bone. The masseter. Okay. So maybe you've heard the word mastication. So like for chewing your food. So the masseter is going to be, we'll look at the location in a minute, but it's going to be involved in moving that mandible, okay, in mastication. Now, the occipitalis, so we know we have an occipital bone that we learned for the skull. So this is going to be a muscle that's going to be located over that bone. Now, remember this Latin term orbicularis. We talked about it when we talked about the rules for muscle naming. So in Latin, that basically means a circular, right? This is going to be that circular type of muscle. So if it's the orbiculus oculi, I know I have two places, right, where we talked about we have these round muscles in our face. One is the eye and one is the mouth. So oculi, right, ocular, that's going to point out, okay, this is that round muscle around the eye. Then I move to orbicularis oris. So the oral cavity, right, we learned that region, the oral region, so that means that's the one around the mouth. Now we have a mouthful in this muscle, the sternocleidomastoid. So this one is named for three different locations. So the sterno part means that it is attached, has an attachment point to the sternum. And then the cleido, that's the clavicle, and the mastoid, right? So that's the mastoid process. So we'll look at where that particular muscle is on the muscle person. And then we have the temporalis. This one's easy, right? We have the temporal bone of the skull, so we know where that's going to be found. And then we have the zygomaticus major. Now that's a new muscle for us. But we do know, we learned about the zygomatic bone. So this muscle is named because it has an attachment site to the zygomatic bone. Now, when we look at it on the muscle person, I'll point this out again, but one of the important things we want to associate with this muscle, this is an important muscle in our facial expression. So this is going to help us to smile. So you could call it your smiling muscle. Now, another thing I want to make a connection. We learned all of the cranial nerves, right? And we talked about different things they innervate. So many of the muscles that we're talking about are going to be innervated by the facial nerve. So think about, do you remember which cranial nerve is the facial nerve? So pause your video and then start it back. So yeah, hopefully you remember that the facial nerve is cranial nerve 7. Okay, so let's first see if we'll just go one by one, identifying these muscles on these models and talking about what their contraction movement would look like. So let's start, let me make sure my pen's on. Let's start up here. So this one that the arrow is pointing to, okay, all of this muscle here, all of that area, that's the frontalis muscle. Now, I'm just going to mention, so as we review, all of these muscles are going to be innervated, right, by a particular nerve. So cranial nerve 7, the facial nerve, innervates many of these facial muscles, but there are a couple of exceptions to that. Now, the frontalis muscle, when you think about it and you look at its location, when that muscle contracts, what do you suppose is going to be the movement that causes? Yeah, so if it shortens, right, it's pulling this direction. So that's like, raising your eyebrows, right? Wrinkling the skin of your forehead, raising up your eyebrows. That's going to be what happens when the frontalis muscle contracts. All right, so you don't see from this view really. We'd have to look at a posterior view, but I think you can kind of get the point. Back here on the posterior side, what we can't see, that would be the occipitalis, because that's where our occipital bone is. Occipitalis. Okay. That's also innervated by cranial nerve 7. Okay, now, if this muscle back here is contracting, right, what's going to happen? So that's essentially going to retract the scalp, right? If you think about what the movement would look like when that's contracted. All right, let's keep going. So this muscle, this circular muscle that we see labeled number 2 around the eye, okay, that's that Latin circular name. That's orbicularis. And I have 2 of those. Oh, that's a U. Doesn't look much like a U. I have 2 of those. So this is orbicularis oculi, okay? And that circular muscle, when it contracts, it's just allowing you to close your eye, right? When you blink. That's also innervated by cranial nerve 7. All right, let's look at this other circular muscle that's labeled number 6 on this model. And we have an arrow right here, okay, on this model. That's another circular name, so orbicularis. In this case, we're talking about the mouth, right? So this is oris. And when that circular muscle contracts, right, then that's helping me to close my mouth. It can even, you can compress them and sort of pucker up, right? Make that kissing movement with your lips because of that muscle. Also innervated by cranial nerve 7. Okay, let's see. Now I'm going to move to this muscle that's labeled number 8 that's over the temporal bone. So that one is called the temporalis muscle. Okay, and that muscle is actually innervated by cranial nerve 5, the trigeminal nerve. And let's talk for a second. So it may not be clear from the image because you can't see everything about where the origin and insertion of that muscle is, but it is involved in mastication or chewing. So when it contracts, it actually elevates and retracts the mandible. So it is involved in our chewing process. Now, the other muscle that's involved in chewing, this is the masseter. Okay, right, this muscle right here. And the when you think about it, okay, what happens when that contracts? So that's going to elevate the mandible, but also it's going to protract the mandible. Now, that there's a link for both the temporalis and the masseter in your lab activity that shows the movement of those. So I highly recommend looking at those. So the masseter is also, just like the temporalis, innervated by cranial nerve 5, the trigeminal nerve. Okay, let's see. I think we only have we have 2 muscles left. So let's do this other muscle on the face. So this, where the arrow is pointing right here to this muscle. So this is over, or it has an attachment to the zygomatic bone. So this is the zygomaticus. And this is the zygomaticus major. There's a minor, which we're not going to require you to look at. You're welcome to remember that if you'd like. But the reason that this is important, I mentioned this in a previous slide. So as it makes sense, right? When this is shortened, right, it's going to pull your mouth superiorly and sort of posteriorly, right? So it's that smile muscle. Okay, so that's what the zygomaticus major muscle is responsible for. Now, the last muscle that I have that's actually on the neck is number 11. So it's this long muscle that's going down from the skull across, okay? This is that sternocleidomastoid muscle, okay? So there's an attachment down here, okay, to the manubrium of the sternum. And it's also got an attachment to the clavicle. Now, up here, it's attached to the mastoid process, which is where the mastoid name where you get that name. Now, there's one on either side. So we see here on this model, right, here's our sternocleidomastoid muscle. The other one on the other side is not shown because we're showing deeper muscles, but there would be also the sternocleidomastoid muscle here, okay? So what kind of movement, if those are contracted, remember the attachment is back, right, at the back of the, what kind of movement would we expect? So if they're both contracting at the same time, right, that's going to cause us to flex. So it brings our chin down, right, toward our chest. But if only one contracts, right, it can give us that sort of rotational movement of our head. And the sternocleidomastoid, it's innervated by cranial nerve 11, which, if you'll remember, is called the accessory nerve. So you also have a large muscle man model in your lab packet, and I just want to point out, so we see that sternocleidomastoid muscle is very prominent, right? We could label that there. You can see the frontalis muscle, right? That's another good one to label. We can see the masseter muscle very clearly. And we can see this temporalis muscle also very clearly on this larger muscle man model.